how to prevent high blood pressure with easy lifestyle and diet changes. I'm a board-certified kidney and hypertension specialist, which means I take care of patients day in and day out with high blood pressure. And one of their most common complaints when I see them in my office is, "Doc, I don't want to take all these medicines. I want to lower my blood pressure in a more natural, holistic way." Well, alrighty then, that may be possible, but there are levels to this and nuances. So let's have a real conversation. Hypertension or high blood pressure is a leading cause of heart disease, strokes, and kidney failure. In fact, high blood pressure is the second leading cause of patients going on dialysis in the United States. It's a problem, and it's a very common problem because get this, nearly half of the adults in the United States have hypertension, yet only 1 out of every 4 actually has it under control. So you see, we've got a big problem. You may be listening to me and you may be thinking, high blood pressure? She's not talking to me. Well, keep listening because I might be. Because according to the American College of Cardiology, the definition of hypertension is a blood pressure of 130/80 or higher. So yes, if your systolic blood pressure, that top number, is 130 or greater consistently, or that bottom number, the diastolic, is 80 or greater, then I am talking to you and you have hypertension. Now, let's talk about some dietary changes that will help to lower your blood pressure and how to use food as medicine. First off, you should have a low salt or low sodium diet. The American Heart Association recommends that most adults have less than 1,500 milligrams of sodium per day. Make sure you're a label watcher so you can see which salty foods you should avoid. Also, be sure to watch my video on the worst foods you can eat if you have high blood pressure after you finish watching this video. Having a diet that is high in potassium can help you to lower your blood pressure. But be careful, if you're someone who has a dietary potassium restriction, for example, if you are a dialysis patient or if you have a late stage kidney disease, then you might actually be on a potassium restriction. But if you have no potassium restriction in your diet, then having a high amount of potassium can actually help you to lower your blood pressure naturally. This is how that works. The more potassium you take in, the more sodium or salt you urinate out, and that helps to keep your blood pressure low. So the recommendation for the average adult is 4.7 grams of potassium per day. Then, of course, the type of diet you have will definitely affect your blood pressure. And there are all kinds of different diets out there, and there's no one cookie cutter diet that works for everyone. Be sure to consult with your physician and a registered dietitian to find out which diet works best for you. But a couple of the diets that actually do tend to work very well for blood pressure are the DASH diet, which you may have heard of. In the DASH diet, you're to eat mostly fruits, vegetables, beans, nuts, also fish, poultry, whole grains. It is recommended that you limit saturated fats and that you limit sugary beverages or added sugar. And certainly all of these things can help to promote a low or a healthy blood pressure. Another diet that tends to be good for lowering the blood pressure and good for your overall cardiovascular health is the Mediterranean diet. The Mediterranean diet focuses mostly on plant-based foods, fruits, vegetables, lentils, nuts, and the fats are mostly from olive oils. Also, fatty fish are really encouraged, like salmon, halibut, mackerel, sardines, not the canned sardines with salt, please. Also, little or no added sugar is recommended. Again, consult with your physician and a registered dietitian to find out which diet is best for you. Having low or no alcohol use is also good for lowering the blood pressure. The CDC recommends that the average adult female have no more than 1 drink per day, the average adult male no more than 2 drinks per day, and if you have excessive alcohol use, this can promote hypertension among other illnesses. Be sure to watch my video on how alcohol affects your body after you finish watching this video. Another way to lower your blood pressure is to limit your caffeine intake. Now, I'm not saying that you have to go throw away all your coffee, you can't go to Starbucks anymore, you can't go to Dunkin' Donuts, wherever you go for your coffee. I'm not saying that. What I am saying is that you should be modest in your caffeine intake, because if you take in too much caffeine, it actually can promote high blood pressure. According to studies, if you have less than 400 milligrams of caffeine per day, then most people won't have a big issue. Consult with your physician. But if you're a big coffee drinker, a big caffeine drinker, big sports energy drinker, all of that, then I advise that you take a step back, because having a more moderate or low caffeine intake is a way to lower your blood pressure. Having a diet that is high in fiber is also good for lowering your blood pressure. It also helps to lower your cholesterol naturally. You also want to stay well hydrated. Be sure to consult with your physician on how much water is the right amount of water for you, and a diet that is rich in omega-3 fatty acids. According to a research review that was published in the Journal of the American Heart Association, for the average adult, about 3 grams of omega-3 acids is helpful for your cardiovascular health. And you can get the omega-3s naturally through fatty fish, through beans, through nuts, through avocados, and there are also some supplements that may be right for you. Now let's talk about some lifestyle changes that can help you to lower your blood pressure. Number 1, you want to exercise. You want to have some regular cardiovascular activity, be it jogging, walking, yoga, tai chi. According to the American Heart Association, most adults should be getting 150 minutes of moderate exercise per week. So that's about 30 minutes, 5 times a day. You also want to maintain a healthy weight and try to avoid being a person who is living with obesity or with being overweight. The more excess body fat you have, specifically your visceral fat or the belly fat, abdominal fat, the more of that you have, the more likely you are to have hypertension, among other health problems. So talk to your physician about ways to maintain a healthy weight. You know what else is helpful for lowering your blood pressure? Starting a gratitude journal. Yes, it's easy to focus on what we don't have. It's easy to focus on what's going wrong. And the more we do that, the more stressed out we become. The more stressed out we become, the higher our blood pressure. So starting a gratitude journal is a way to really ground yourself and to calm yourself. And this can help you to lower your blood pressure. You also want to reduce your stress. And yes, I know that's easier said than done. But when you are stressed, that causes your stress hormones to rise, like your cortisol and your adrenaline. And when these stress hormones rise, that causes your blood vessels to tighten and it makes your blood pressure go up. So figuring out ways to reduce your stress can be helpful. Another lifestyle modification is to stop smoking cigarettes. I cannot tell you enough how bad smoking is for you. When you smoke cigarettes, this causes damage to the inside of your blood vessels, and it increases your risk for atherosclerosis, or from fatty deposits being on these damaged blood vessels. When this happens, you get a narrowing of the blood vessels, which of course can lead to high blood pressure. It also can lead to heart disease because the heart has to work harder to pump against this high blood pressure. So please, stop smoking cigarettes. Another lifestyle modification you might want to try to lower your blood pressure is to adopt a pet. There's actually some science behind it. There was a Harvard Health publishing article that showed that people who owned dogs had a lower blood pressure and better cardiovascular health than people who didn't. There was also some data to suggest that when people pet dogs, their blood pressures tend to lower. Now, of course, this is not everybody. If you're scared to death of dogs, that's not going to work for you. And if your dog does like my dog, Shadow, and she goes in the trash and gets on your nerves, okay, she can make your blood pressure go up. But overall, consider adopting a pet. And maybe that would be a good way to reduce some stress in your life, bring a calming aspect, and lower your blood pressure. Some other things you can try are volunteering in your community. Also, get a new hobby or pick up an old hobby. Painting, playing the guitar, I don't know, underwater basket weaving, whatever it is. Kind of step outside the box and do something that is relaxing for you. This will help to decrease stress and can lower your blood pressure. Yeah, get a hobby. Oh, and make sure you get on your sunlight. Don't just lock up in the house and get depressed and stressed. Go out and get some sun on your body. And that may be a way to help to boost your mood, decrease stress, and lower blood pressure.